is a consultant clinical pharmacist, lecturer, and public health manager. She's the first vice chairman and CEO of LiveWell Initiative, a self-sustaining non-profit healthcare social enterprise. And importantly, in April 2017, she founded Women in Hepatitis Africa. And this is the voice of women of Africa joining hands to eliminate viral hepatitis by 2030. So, Bisi, we're very sad that you're not with us, but we look forward to your presentation. Thank you.
Thank you. Good morning, everyone. It's a privilege to be here. I'm speaking from Lagos, Nigeria. I apologize that I could not join us in person due to a very, very supervening situation, but I'm happy to be here with you, and I'll be sharing my slides now. Thank you. I represent the CSOs, the civil society organizations, and the patient voice. And within the civil society organizations, we have the patient advocates as well as the patients, and of course, healthcare practitioners who work within the CSO sector. So this call to action is to emphasize the need for testing and treatment, and we feel that the time is now. But before I go into my script, I want to say a very big thank you to the organizers of COLDA. I had the privilege of being a member of the conference planning committee, and we've been meeting for about a year now. Of course, led by Professor Wendy Spearman, who is the chairman of the conference planning committee, and all the other medics and professors in the committee. It's been a privilege working with you all, and thank you for the privilege to make this call to action on behalf of the civil society organization. So in the CSOs, we've been doing a lot of work in the community, and we see the patients firsthand. And we were so happy when in 2020, in 2019, the WHO emphasized the need for the prevention of mother-to-child transmission of viral hepatitis as being a priority area for eliminating viral hepatitis. Of course, the policy had always been there, but the WHO now brought it more to the fore and then improved on the targets and everything. And so at the LiveWell initiative and the Women in Hepatitis Africa, we've been doing a lot in this area. In fact, in July 2019, that was when we adopted our PNCCT in hepatitis policy. And these pictures you see here, we're using most of the pictures, in fact, all the pictures I'm using in this presentation have originated from our own work. They are original pictures from us. So this was the world, one of the world hepatitis programs that we ran. We actually had the World Hepatitis Day program in 2021. And then after that, we had the liver conference, a liver confab. And to engage the community, we brought in the women. These women are in a blighted, low-income community, low literacy women. But we wanted them to be part of this liver health confab. And so we had a post-liver health confab webinar, which was hybrid. And we went into the health post, and we got these women to take part in it. And we screened the women, and attendees at the webinar could actually witness the screening by multimedia. So these two women are pregnant women who took pictures, and you can see they are carrying placards saying, "I have been screened for viral hepatitis." So we've been screening the women, and the call to action by the CSO is just to emphasize the fact that we need testing and treatment now. We need testing and treatment of every pregnant woman now, and we need testing and treatment for every child now, because inadvertently there's a lot of vertical as well as horizontal transmission of viral hepatitis in Africa. So we need funding now. That is the main call for a call to action. And why now? Why now? It's because there are over 320 million people living with viral hepatitis worldwide, and 70% of them are in Africa. And 9 out of 10 people who are affected are not even aware, and the hepatitis is not funded. So there is very, very little access, like Professor Wendy Sperman said in her presentation just now. And 2 million people die daily of liver disease generally. So when Dr. Margaret, Her Excellency, was talking about the various types of liver diseases, and over 2 million people dying daily. And then viral hepatitis B and C have a prevalence rate of 12 and 14%, 4% respectively in Nigeria. And we know that the burden in Africa is as high as 70% of all the hepatitis patients worldwide. So the disease burden posed by viral hepatitis definitely needs very urgent attention. And I can just look again at those statistics that were shared by Professor Fumileshi. They were very, very staggering statistics. So this picture actually depicts what we're doing at the health post in Shogunro Makoko, which is where we have the Women in Hepatitis Africa. It is actually the only women's organization that is working solely on hepatitis in the continent of Africa. If you look at the woman to the right-hand side of your screen, she is so pregnant, so heavily pregnant. She actually delivered her baby within 2 weeks of this of the World Hepatitis Day, of taking this picture. So we do bring in the women and we screen them. We work with government, so the local government nurses come in, they actually preserve the cold chain and come in with the vaccines. So we run the antenatal and the immunization clinics together. And on World Hepatitis Day, rather than run it in the clinic, we actually got a tent, brought them together under a tent to incentivize them. We do that from time to time because these are low-income women. To get them to come out and get screened is always a challenge. You need to incentivize them. So on antenatal day, we incentivize them by giving them their hematinics. Of course, they get checked and screened, and we encourage them to go to the government accredited birthing centers so that when their babies are born, they can get given the birth dose vaccination. So the hepatitis testing usually takes place, like I said earlier, on the same day that we do the antenatal. Some bring their babies for immunization, but we do the antenatal testing for the women on the antenatal hepatitis testing for the women. And you can see the picture on the right actually shows one of those days. So this picture just shows that on antenatal days, you can see the nurses, screening the women, but we need to incentivize them. So the picture on the right actually shows one of the women who is she's been given a mask, a face mask, and we do sometimes offer them little gifts to incentivize them. But hepatitis is not funded, and so it becomes increasingly difficult to sustain these laudable programs. And because it's not funded, we have to buy the kits, incentivize the women, buy the consumables, the needles, the lancets and everything that is used in testing. And then another thing that comes with this is running a PMCCT program. In a low-income area, you find the women always come accompanied by children because many of them are petty traders or they work from home and they can't even afford to employ a helper. And so when they're coming for screening, they come with their babies. So the picture on the left shows what happened on World Hepatitis Day, where the women came with their babies, and of course, sometimes you have to incentivize them. I think we gave those children balloons or something on that day. We just have to find a way to make provision for them. And then the program on the right was a bit more elaborate. We actually partnered, we had some partners because it was the liver health confab, and it was the post-liver health confab screening. where we had the women coming, but they brought their children, so we had made flags for them. These are some of the things we do for retention to be able to retain the patients, the clients, and so on. So the actual call is this. There is a need to have a dedicated funding for viral hepatitis, and we implore the African Union to take the lead and kindly escalate this to the Global Fund. We need a dedicated funding for viral hepatitis because the disease burden of viral hepatitis is so huge now. And then the CSO voice needs to be heard. The CSOs need to be carried along right from the community level. We can help with the screenings and early detection. And so all those data of liver diseases, very high statistics, would be curtailed when there is early detection, early screening from the community level, working hand in hand with the CSOs. I'm happy some of the speakers have said that earlier on, that the CSOs are very important in this continuum. And then the PMTCT should be adopted in Africa as a policy. I know it is already there, but by saying it should be adopted means actualized, enablement of the implementation of the PMTCT in every country in Africa. And the first way to start that is to ensure or encourage African governments to take up and implement the birth dose vaccination policy, which Dr. Margaret mentioned, that only 14 African countries have started implementing this. So there is quite a lot to be done. And so our call is focusing on the birth dose vaccination, working with the CSOs, dedicated funding for viral hepatitis, and putting PMTCT to the fore. And the time to act is really now. I'll be happy to discuss more. I actually made the presentation short so that I'll be able to discuss and answer questions. But this is where I end this call. Thank you very much.